Menopause belly fat explained and how to fix it. So, have you noticed that your belly is changing even though you're eating the same, exercising the same, and living the same? You're not imagining it. Menopause belly fat is real, it's common, and it's one of the top complaints I hear from women in midlife. But here's the truth: while it's caused by hormones, it is not inevitable. So, today, I'm going to explain exactly why it happens and what you can do about it. I'm Dr. Rebekah Hertel. I'm an osteopathic family medicine physician and menopause specialist. I work with women every day who say, I never had the belly before, and suddenly it's here. In this video, I'll cover the science behind these body changes, the mistakes most women make when trying to fix it, and the strategies that actually really work. I have a lot of women that come to me in my practice discussing this very topic, or DM me here on YouTube or Instagram or on TikTok as well. So, why does this happen? That's usually one of the biggest questions that I get asked by my patients. So, as estrogen declines, estrogen helps control fat distribution. As it drops, then fat gets redistributed to the abdomen and it gets around our organs, so around our liver and our heart. That's what makes it dangerous. Also, metabolism slows. So we naturally lose muscle mass with age, and it's a certain percent per decade. Less muscle is slower metabolism because muscle burns more at rest than adipose tissue. So, the next, insulin resistance. Hormonal shifts make the body less sensitive to insulin. This promotes belly fat. Then there's our stress hormones. Cortisol spikes from busy midlife lives or lack of sleep, and this also can encourage belly fat storage as well. But why old fixes don't work? More cardio, less food is a classic advice, right? This is what we were all taught. This is what we could do back in our 20s, but it backfires. Over exercising without strength training burns muscle and slows metabolism, which is what we don't want, right? We want to keep that muscle mass because we know that muscle burns more at rest than adipose tissue. Very low calorie diets also trigger the body to conserve fat as well. So, what actually does work? Strength training. 2 to 3, I like to do 4 sessions per week builds muscle, which burns more calories even at rest. So make sure that you're using bands or cables or dumbbells to resistance train as heavy as you can for a shorter amount of reps. Protein at every meal. Aim for 25 to 30 grams. This supports muscle and keeps you full. Sleep and stress. Poor sleep increases cortisol and cravings. Stress management is just as important as workouts. Medical help. Hormone therapy can help prevent the redistribution of fat. Medications such as GLP-1s, like semaglutide or tirzepatide, may be appropriate for some women with stubborn metabolic changes. It can be helpful for women who meet the BMI criteria, some women that have already type 2 diabetes, and some women that have things like obstructive sleep apnea or high blood pressure, high cholesterol. For example, one of my patients came in frustrated, running 5 miles a day, couldn't lose belly fat. We shifted her to 2 to 3 days of strength training, much as you can lift for 3 to 4 reps, right? 20 to 30 minutes. Bumped up her protein and worked on stress management. And within months, her body composition started to change. So, menopause belly is real, but it's not necessarily forever. When you combine the right lifestyle strategies, strength training, protein, sleep, hydration, stress management. With medical options when needed, you can feel strong and confident in your body again. So, if this video resonates with you, make sure to hit subscribe. I share weekly tips for thriving in midlife, and stay tuned for my next video. I'll show you exactly how to get started, even if you've never picked up a weight. The best workout for women over 40, strength training basics.